how to understand depression, because depression is a descriptive term. A person is depressed. It has also become a clinical term. He is suffering from a depression. Depression is diagnosed kind of like diabetes or heart disease. I think that there is a feeling of depression that is important to know. If there is a loss, a person has lost a family member, a person has lost his fortune. These are realistic feeling of grief. It's a grief kind of depression. Again, antidepressant and Prozac cannot change these feelings. However, there is something within our system, that our chemical system, that does affect the way we feel. And if we have certain disturbance in our hormones, right, it changes the way we feel and can give us a feeling of severe depression and despair. Now, that can be brought up by anything. And sometimes out of the blue, maybe hereditary or a great deal of stress, insomnia, pressure, all of these things can produce a biochemical depression. Now, if it's turned into biochemical depression, it's when antidepressant can help. So I think we have to be able to distinguish between the two types of depression. I can be depressed but not have a depression. Strangely enough, one can have clinical depression and not be depressed. And it will show itself in an inability to feel right now. I believe that when suicide happens, it comes from feeling of despair. And I believe that despair is almost invariably due to the biochemical changes where the person looks at a blackboard and thinks it's a window and sees a world as hopeless. So I think we have to be able to determine what is it that we're feeling and why, and what is correctable and how should we do it correctly. Trying to do psychotherapy with a person who got biochemical depression is like trying to turn on the television set when it's not even plugged in. So I think we have to understand what the nature of our depression is and be able to approach each part of the depression with what is appropriate for them. So ask yourself, what type of depression do you have? And if it's something that you are not sure of, maybe going to a therapist can be able to help you distinguish what type of treatment is right for you, instead of just blindly going to your primary care doctor and getting antidepressant. Now, when it comes to medication, that's something that is important for you to discuss it with someone professional, but try to understand your depression. Try to ask the questions that are hard to ask, because a lot of time these questions are not easy to ask.